Hello, I'm Dr. Sarah Dalton. I'm a paediatric emergency physician with a strong interest in clinician wellbeing. Doctors have been shown to suffer from high levels of depression and burnout even at the best of times. But at the centre of the COVID-19 pandemic, many doctors and healthcare workers have been under even greater pressure than normal. But even during the time of crisis, or perhaps especially during the time of crisis, it's important to be attentive and responsive to our own wellbeing as clinicians. Today I'm going to be discussing this with Dr. Chris Vagias and Dr. Lynne McKinlay. Chris is a basic trainee at Austin Northern in Victoria who will be applying for geriatrics training. Lynne is a paediatric and rehabilitation physician. She is a medical director, learning and workforce at Children's Health Queensland, as well as a senior medical educator at the Cognitive Institute, where she teaches on clinician wellbeing and resilience. Welcome, Lynne and Chris. How are you?
Well, thank you. How are you?
Thanks, Sarah. Great to be here. Nice to meet you, Chris.
Yeah, you too, Lynne.
Thanks for the opportunity to talk with you both today a little bit about the situation we're in with COVID-19. And I know that as clinicians, it's something where we sometimes forget to put on our own oxygen masks. I'd like to talk to you a little bit about some of the challenges that you're having, that you see your peers have, and possibly some advice that you might have for others that could help them at this time. Chris, I'd like to start with you. As a trainee, I wonder if you could just outline a little bit about what some of the challenges have been like for you at this time.
Yeah, thanks, Sarah. I think the first thing to say is, on a daily basis, the thing that scares me to no end and the thing that I worry about most is potentially giving a patient who I'm there to help COVID-19. Ultimately, we've been told that now's not a time for heroics and absenteeism is better than potentially harming someone. But I really worry that, one day I'm going to go to work and there's going to be a patient there that I've given COVID-19 to. And that's something that I've been grappling with on a daily basis.
Yeah, thanks, Chris. That's so tough for all of us, I know. And I think the other thing that reminds me of is the fear that we might spread or transmit COVID to our friends and family, which is another massive challenge. Yeah. Can you tell me a little bit about how you're managing that? That's really tough.
I suppose the first thing is I've got a supportive group of friends who are both doctors and non-doctors who I can talk to about things and let them know how I'm feeling. And my fiance is sick of me asking her, should I go to work? Should I go to work? Should I go to work? Because I think a lot of my anxiety has manifested in symptoms not dissimilar to those that people might feel from COVID. So it's just about having that backup and that network around you. I think that's the thing that's sort of helped me through the most.
Thanks, Chris. I really appreciate your honesty. One thing I think we're not great at as doctors is allowing ourselves to be a bit vulnerable and to express that to others. So I really value your input. Thank you. I might actually now ask Lynne to respond and perhaps help us with some of those challenges, because we've heard about fear of transmission to others, fear of our own well-being, potential implications for making a medical error and the cognitive biases that come in. Lynne, what are your reactions? What are some of your challenges?
Well, I guess I've had a few different challenges to those of Chris. I'm not doing a lot of active clinical work now. I do one clinic. In my education role probably is where I've seen the biggest change, because I've gone from going out and conducting workshops to doing a lot of Zoom work. So I've had to become, like a beginner again. And I guess that is always a bit of a challenge when you're used to being fairly proficient at something. So in some ways, all of us are beginners again. I think having that humility to understand that, we all have to rely on each other and ask for help is probably the big thing, and to ask for feedback about how we're doing. It's interesting, I think, your comments about the fear and the anxiety. I think regardless of our roles, we're all feeling that. So it is that bit of a sense of we're all in this together. I heard a really good, I was listening to somebody else doing a webinar, and they talked about the fact that I really like this line that fear and danger are not the same thing. Yes, there is danger, but we have to think about how to deal with that, because fear kind of makes us a bit stupid in some ways, like it sends us into that defensive mode. So it's actually about recognizing the fear and thinking that that's a healthy kind of response, but how do we actually then move up to kind of being safe? And that's about, I think, asking for support from our colleagues and making sure we get the right information, and then really planning what we need to do and getting kind of organised.
Thank you, Lynne. I was just thinking about how quickly we've started talking about fear and vulnerability, and how long it normally takes for doctors who get together to talk about those things. You've given a few tips around how you manage. Maybe you could expand a little bit on either what you do or what you've heard others do, or how can people manage that level of anxiety at this difficult time?
Mm-hmm. You know, I was really lucky that I've had the opportunity, I suppose, to learn quite a bit about wellbeing, and particularly for doctors. And one of the things that I have learned is that we are not good at putting our own oxygen mask on first, as you said, Sarah. So some of the things that we know that do help are things like mindfulness practice, and they are things like getting together with peers and talking and allowing other people to support us. But we haven't necessarily culturally kind of let ourselves look after ourselves. I think there is a little bit of a shift. I think people are more, because of the fear around this, people are a little bit more open to thinking about self-care. And whatever that looks like for you it's different to what it looks like for me, I guess. But there are some basic principles about this idea of, you know, having kind of calming opportunities, whatever they might be. You know, I've never done meditation or anything, but for some people that's the thing, right? And other people it might be exercise, or other people it might be getting together with friends. But actually having enough, I guess, self-reflection to figure out what it is that calms me and helps me, and then actually give myself permission to do that thing.
Thanks, Lynne. I was just thinking about one of the things that I've learned in this is how we all, and doctors particularly, need to remember our MEDS, our MEDS, which is our meditation, exercise, diet and sleep. And all the really basic foundations, when you think of the hierarchy of needs, as doctors we haven't necessarily had to think about that before, but we really do need to consider our safety and our health before we can ever be in a place where we can look after others.
I was just reflecting on what Chris said about not being a hero. And I think many of us trained and grew up at a time when we were expected to be kind of that heroic, you know, miss a meal, go without sleep, don't look after yourself. And that's actually not safe, and it's not good for us, and it's actually not good for patients, because we're going to much more likely make a mistake for our patients if we are not rested, if we haven't had a meal, if we're dehydrated. Our cognition is not going to be good. So for me, I think there's a sort of an opportunity now for us to realize that our well-being matters, not just for us, but for our patients, and it's okay to prioritize it. It's right to do that.
Yeah, it's definitely about reframing, isn't it? It's no longer about, as I can remember, the 16-hour shifts where you were being asked to review patient urine output and you realised that you hadn't had any of your own for that last 16 hours.
There's some papers on that, right? Doctors' urine output being worse than the patients.
Yeah, that's right. But, you know, isn't that a terrible thing? As a culture, we embrace that as a mark of honour rather than necessarily what it was, which is that we weren't looking after ourselves. There's so many things that need to be in place for us to look after ourselves, and some of them are within our control and some of them are not. And I guess it's about working on what is within your sphere of influence. Chris, I might just come back and ask you, because I think it's a really important perspective as a trainee about so many things that aren't necessarily in your control. But what is within your control, and what can your supervisors potentially do to help? So how can supervisors and hospitals and your peers and your consultants actually help basic trainees and advanced trainees at this time?
Yeah, so I think it's both parts of the question are really great. And I think the first part, and what can I do to help myself? And it's ultimately being honest and putting up my hand and saying, hey, I need help, and taking away some of that stigma away from, oh, I do need some assistance, or I need a day off, or I can't come to work today because I just feel like I'm not up to it. You know, I think being able to speak to your local wellbeing officer or clinical psychologist who's there, or you know, private psychiatrist. I see one every fortnight, and I'm not ashamed or afraid to say it. I think being able to own that and just say, hey, this is me, and this is what I do to help myself. In terms of the consultant thing, I'm glad you asked, because there's some really, you know, there's a really important role for them, and making us always feel supported both in our clinical decision making by saying, hey, call me whenever you need. As long as you're at work, I'm at work. Or if there's an on-call roster, you know, not being afraid to pick up the phone and always being treated with that level of respect and understanding that we're asking for help because we feel we need it. And always just being there to listen. When it's not clinical stuff, if we just want to debrief about something, we've got so many great bosses, that we can sit down with and talk to. And I just value that so much. And they may not even be people that I'm working with at the moment, but they're bosses that I've met along the way, and registrars and advanced trainees that I've met along the way, who I can pick up the phone and say, hey, this was my day and it sucked.
Sometimes you just need someone where you can be that honest, and I guess sometimes it's your boss or your peers or your partner or your friends, but having a way of talking about it. And I think the thing that stuck out to me is the way that you reach out for help and the way that you provide help to others.
And I think part of that is, I feel I'm really lucky in that I'm able to do that, and it does make it a bit easier once you've reached out. But for everyone out there who can't reach out for help, I just encourage you to speak to your boss, speak to your friends, speak to your GP, speak to anyone, because at the end of the day, I think you'll be better for it.
Thanks, Chris. And I think that sometimes when you ask a question like that, you'll often get a really surprising response. We often assume that I can't ask for help because I shouldn't ask for help, and if I do ask for help, I won't get it anyway. But when you put your hand up, you'd be surprised how people will respond with compassion and kindness and support, which is exactly what we all need. Lynne, what are your reflections? I know you know a lot, talk a lot about this. How can senior doctors help in this situation?
You know what? I was just thinking about what you said, Chris. I think a lot of senior doctors want to be asked to help. They want to help. They see it as part of their role. We see it as part of our role. And I think when we are asked to help or asked to listen, we find that, to be really very privileged position to be in. In every hospital will have somebody in equivalent of my role, somebody who's in the medical workforce sort of team. So not a direct boss, but somebody who's at the level of the boss, if you like, to use your language. And, that is part of our role, to support doctors at any level in the organisation. So, I would think you would find that your medical administration and your medical workforce leadership would be very open to listening. The other thing I was thinking from what you said is that one of the principles about providing psychological support to each other, this idea of peer support, which I think the literature tells us is extremely powerful for well-being, and it's extremely powerful during any trauma or disaster like we're currently experiencing. So this idea of peer support is we don't have to fix it. And I think one of the challenges for us as doctors is we like solving problems, and somebody comes with a problem, we want to tell them what to do to fix it, because that's what we're used to doing with our patients. It doesn't always help our patients either, by the way. And sometimes what we need to do is to just listen and make you feel understood, and let you know that those feelings are fine, and that as a junior doctor I had the same feelings, and just not sort of try to make it go away necessarily, just to help you hold that feeling.
I was just thinking, Lynne, we are trained from the minute we go to medical school to find an answer and give a solution. And things like, I feel really anxious because I don't know what's going to happen next, and I'm not sure what's going on with the pandemic or with my job or with my role. There's no answer for that. But a problem shared is a problem halved, and I guess what I'm hearing is that we just need to be able to talk more about what matters to us and to support each other. Before we finish, I just wanted to ask if there were any final reflections from each of you, things that you haven't had a chance to say yet, maybe some advice for someone who's having a tough time in one of their medical roles. I might go to you first, Chris, and then after that ask Lynne for some final reflections.
Just put your hand up, ask for help. Please don't be afraid. Ever. There's always going to be someone who will listen. And I've found it really, really rewarding to seek out help, but also be part of a mentor program where I can offer help and just an ear, like Lynne said, to hear what's happening. And I think it's more than just listening. It's sitting down and actually hearing what the person's saying, and then ultimately being able to direct them whichever way you think's appropriate.
Yeah, that's a good point. And sometimes it is about offering to help them find a way, which isn't the same as telling them what to do.
Any final words?
I was just, because I've been doing quite a lot of webinars recently on self-care and on on dealing with all of the distress that we've been talking about. The most important thing seems to me for us as doctors is about connection to each other. So social connection at work, connecting to our peers, connecting to a friend at work, connecting to our colleagues, and that's all our multidisciplinary colleagues. That seems to be the most powerful thing. So I think that's probably the thing to build those connections, make use of those.
It's a lovely way to end. Thank you very much, Lynne. Thank you, Chris.
Thank you.
So what an amazing opportunity to listen to two people. But remember that there are so many people where you work that you can talk to both in hours and out of hours. We've heard that we have all got a lot of challenges. This is a really difficult and tough time. But we've also heard that we have a lot of enablers. We have a lot of strengths and a lot of supports, and it's really important to be able to tap into them. And what we finished with just now is one of our greatest strengths and supports is each other. We have the opportunity to reach out, to connect, and to support each other as peers, as doctors, but ultimately as humans. Thank you very much for listening to this today. I hope it's been of some value to you. If you are looking for somewhere else to go for more information, please contact the RACP support program. They'd be very happy to help. Thank you very much, and all the best.